Good afternoon. My name is Jayla and I'm going to be your nurse today. Today we're going to perform a cardiovascular assessment.
Okay.
Before we begin, I'm going to ask you a few questions.
Okay.
Can you tell me your full name?
Sylvester Villalobos.
And your date of birth?
1/10/90.
And what is the current year?
2023.
Great. And can you describe any pain or discomfort you're currently having?
None. No.
Okay. Nothing's bothering you at this time?
No, none at the moment.
Okay, good. And my next question is a little personal, but can you describe your smoking, drinking, and drug habits?
Well, it's not personal. I vape and I also drink socially.
Okay. I just want to make you aware that those three things directly affect your heart. Okay? So we're going to begin the assessment now. I'm going to first start by assessing your eyes for perla.
Okay.
Also going to assess for arcus senilis, which is a light gray ring around your iris. This is indication of lipid metabolic disorder, which is a sign of coronary artery disease. But you look perfect.
Oh,
Okay. And I'm also going to take a look at your skin underneath your eyes to see if I notice any xanthelasma, which is a yellowish raised plaque-like skin.
Okay.
Your eyes that indicates hypercholesterolemia, which is also an indicator for CAD. If you don't mind, I'm just gonna feel the texture of your hair. We want to see if it's super fine or coarse, because if it was either one, that would indicate a thyroid issue, and then thyroid issue could eventually lead to a heart or cardiovascular condition.
Okay. I have hair product in it, but that doesn't matter.
No, it feels lovely. I'm gonna move on to your carotid artery. I'm just gonna palpate, make sure that everything is normal. Do one side at a time. Lovely. If you could just put your head back slightly to the side. I'm going to see if I see any JVD, which I do not. Can you turn to this side? Great. Looks great. Now I'm going to listen with my stethoscope with the bell to see if I hear any breeze. Sounds great. Now I'm going to listen to all 5 landmarks of your heart. Okay. Start with the aortic and the pulmonic, Herb's point, tricuspid valve, and mitral valve. Your rate and your rhythm sound normal. I don't hear any murmur. Now I'm going to take a listen with my bell, all 5 landmarks again, to make sure I don't hear any gallops or clicks. Okay?
Okay.
Okay, now I'm going to listen to your aortic and renal artery. It might tickle, okay?
Okay.
Just need to locate your belly button. 2 fingers above that. 2 fingers to the side. Two fingers to the other side. Everything sounds normal. Take a look at your upper extremities. First, I'm going to take a look at your nail beds and check your capillary refills. You want to make sure they are under 3 seconds. And how does it feel when I'm pushing against your fingers?
Normal.
Any tingling?
No. Why would it be tingling?
Just want to make sure that you're getting proper blood flow to your fingers, and if you had tingling, that would indicate adequate blood flow.
Got it.
Okay?
No, they feel normal.
Good, good. And now I'm gonna take a look at your radial pulses on both wrists to make sure they are both strong and normal. Great. And both strong and normal, which they are. Well, I'm going to take a look at your lower extremities. I'm going to check your lower extremity pulses. Start with your femoral pulse, which is between your groins. I'm going to check both sides. Great. Now I'm going to check your popliteal, which is behind your knee. Great. And then I'm going to check your dorsalis pedis on top of your foot. But first I'm going to put some gloves on.
My what?
Dorsalis pedis, which is the top of your foot.
The big vein?
Yeah. Great. And then I'm going to check your posterior tibial pulse. And they are both normal as well. All right, now I'm going to check your capillary refills on your toes now. Sorry, it might tickle. And do you have any tingling sensation down here?
No.
Good.
Just tickling.
Well, that's normal, as long as you can feel me touching your foot. And can you push down on my hands? And can you resist me pushing them down? Great. Now I'm going to take a look at your lower legs, if you don't mind lifting your pant legs up a little bit for me.
Sure.
Thank you. And the other one, please. Great. Great. I don't see any edema. Your hair distribution looks even. Okay, thank you. Please think. This concludes our cardiovascular assessment. Do you have any questions or concerns for me at the moment? Okay, I'm gonna go speak with the doctor and then she will be in shortly. Okay?